पॉलिसी बाजार पर 1 करोड़ रुपए का टर्म लाइफ इंश्योरेंस केवल 450 रुपए महीने से शुरू। वाव!
One of the biggest government hospitals in the state of Karnataka and here in Bengaluru, the Victoria Hospital. Now put together within the campus, we are hearing there are at least about 2,000 beds. Yes, of course, from the first, the second wave and now third wave, we've also seen especially where, the bed capacity has already been enhanced. More importantly, today where the mock drill is being conducted right here at the Victoria Hospital, of course involves the preparedness in terms of the bed capacity, in terms of oxygen as well. So to join us and to tell us more about this is Dr. Ramesh, the Superintendent of Victoria Hospital. Thank you for joining us here on NDTV.
Thank you.
Dr. Ramesh, if you could tell us what is the kind of preparedness that you all have taken this time around when you really compare it with the previous waves?
This time we are very much prepared. The first two waves we have treated more than 15,000 cases, so it's not doesn't need much preparation. We are all ready. A stable patient who will be admitted to the ward and an unstable patient who will be admitted to the ICU. So
okay.
This is a mock drill for a patient who is unstable.
In terms of the patient and the doctor's ratio has always been, not really up to the mark or average. Correct. So this time anything, in terms of enhancing the workforce, is something that way have you all done?
So enhancing the workforce we may need as and when required. We may tell it to our superior officers like the Bengaluru Medical College or the Government of Karnataka. At that time we may need. Right now we do not need anybody.
Okay. What were the challenges that you all faced during the previous wave?
The challenges last time was we were not used to the second wave. The second wave, the patients were very bad, and we had to manage them in the triage area, in the trauma center, everywhere. And then the number of deaths were more, very high, and we had a lot of difficulty in managing those patients.
Right.
So we are going to, it's because we have the previous experience, it won't be a problem for us. As per the oxygen, we had some cylinders set up. We have about 3 tanks of oxygen.
Is this something new that you're looking?
No, we had 2 tanks. We have got another 13 KL extra tank that we have got enhanced that. And oxygen generators we have now about 4. And apart from that, we have the usual oxygen cylinders and other things. So we have enhanced our oxygen capacity.
Okay, I'm going across to Dr. Ramesh, who is in the ICU. Can you tell us what was a challenging kind of a situation for you during your previous waves, and how exactly are you preparing this time around?
Previously, it was more of the panics which most of the patients had, and psychologically they were more of depressed, and so boosting the morale of the patient was more important along with the treatment. And also we had little issues with, as our medical superintendent has told, that the resources what we had was not shortage, yes. And the oxygen has also been upgraded as of now. Initially those were the few glitches which we faced it. We have updated those things, and we have improvised on that part. Coming to the staff's part, the training of them adequately and boosting their morale has played a major role here.
Okay.
So that
has been a major
our
exercise that you carried out.
Okay. So that the nursing staff don't have that fear of treating a COVID as of now. Okay. So they're ready to do it in a better way. Instead of getting scared, they're doing it in a more organized way.
I believe it's the most difficult time for, especially the staff within, inside the ICU especially. Yeah. It's most training mentally, emotionally. So how exactly, when you're talking about when the healthcare officials, professionals are completely down, how exactly are you planning to fill in those?
It's always I told you, the psychiatric the psychiatric support, what we do normally, and training and boosting the morale of the...
No, what I meant is, what if more number of healthcare professionals, especially within the ICU, they are also down with COVID? What is your other alternative for the worst case scenario? How are you all preparing for that?
For that, we have again the other institutes which we have under the government of Karnataka. We are training those people with the comprehensive life support training programs.
So is that something ongoing? Is that something
ongoing.
new?
It's ongoing from the BMC, which our Professor Dean and Director Dr. Ravi has taken that initiation, and he is doing that
aggressively on.
Yeah, it's been aggressively
in the view of this particular
training, especially the nursing staff for the ICU care, is pretty good as of now.
Okay.
So that
if you could also, doctor, if you could explain to us, once we understand it's from the triage. This is after a patient is tested positive. There are oxygenated beds as well. So this in the ICU. When exactly actually do you take in patients here? Because I believe that also was a major cause of concern. We have seen patients running from pillar to post, requesting for a ICU or even for that about a HDU bed. So when exactly do you take that call?
Yeah, the concept of triaging is very important for the public people to know about what is triaging and what are the vitals which are unstable. And based on the vitals which are unstable, we take the patient into the ICU. So when the patient lungs are bad, when he is not able to breathe adequately, when his conscious level are deteriorating, that is the patient which has to be in the ICU. Otherwise, he has to be in a high dependent unit where he will be observed for a deterioration. If he deteriorates, then he goes in for the ICU. If not, he stays back in the high dependency units. If he is a stable patient, he stays in the ward, observed, routine investigations are done. Then probably after that, they repeat investigations, and with the improvement of the investigations, the improvisation of the patient's condition improves, then probably we are shifting him to the wards or discharged out.
Okay.
But if the patient deteriorates with all the vitals and he needs invasive ventilation, then probably will be shifted to an aggressive or the ICU, which is the main ICU, which we have 4 beds reserved for as of now. That patient will be aggressively managed with all types of HFNC or whatever is needed. We will do with that. In that ICU.
Okay. Do we know, I believe that, with new variants, it's always the new challenges that come in, right? So earlier, probably during the second or third wave, we had an idea how long a patient will have to be in the hospital admitted. Do we have any idea for the new variant?
To be frank, we don't have any idea, and it's unpredictable. 4 patients have been turned positive, and till now we have not received any of that patients who have gone bad. So if that condition comes down, then probably we have to experience that, and based on that we need to take a call on how aggressively we have to manage that and what are the glitches that we face in this situation and how to improvise on that.
So the 4 patients that you said for the new variant, are they here in this hospital?
No, as of now, nobody is shifted here.
All right.
Higher ups.
Thank you so much, Doctor. In fact, the mock drill that's being conducted at the Victoria Hospital, of course, they have enhanced the capacity. That's what the doctors and the superintendent also tells us. More importantly, what they also say is that it's very crucial, especially during this time. It's very stressful, especially on the health community, the professionals. Now that is the time when the health professionals at maximum, when they are also down with COVID. What are the other alternatives that especially they have prepared for is they are actually training students so that during those times, the most challenging times, can actually come and fill in. Not just that, even beds have been increased and also oxygen. Now the oxygen plants, and not just that, even the cylinders, those are certain things that are now being looked into, because these are some lessons which of course doctors and also hospitals have learned during the previous waves. In Bengaluru with Kumar, Sreeja for NDTV.